everyone, this is Dr. Huerta from Kaplan Chiropractic. This week we're talking about car accidents. One of the things that here in the office we actually treat is not only the symptoms from a car accident, we actually treat their posture. When you are involved in a car accident, the sudden movement after the impact will make you more prone to actually lose a little bit of the curve, your natural curve of your cervical spine, thoracic spine, and lumbar spine. So one of the things that we use here, we use different blocks to help you regain that curve after the accident. So I'm going to use Vanessa, she's our manager. She's going to come here and she's going to help me show you how we use this block in the office, okay? So the first one we start is with the cervical spine. This is done especially in patients that obviously they have that whiplash, their neck is extremely stiff and they can barely do the normal range of motion. We're going to start first, the patient is going to be laying on their back, we're going to be sitting, over that, perfect. For this one we have different levels. We're going to start a little bit higher because by then the patient still cannot extend all the way through, okay? So we're going to go like this, always helping the patient go down, and then we're going to start there. Here, we'll usually apply a little bit of pressure here to help regain some of that extension, and we press down here on the shoulders. The more far along they go through their treatment and their extension gets a lot better, then we actually can start positioning this a little bit lower, and then the same movement. You see how much extension the patient gets. And believe me, it looks simple, but it does wonderful for your posture. So this is for your cervical spine. For your thoracic spine, we use this one. This is a little bit more intense, believe me, and we actually wait a lot before we start this one. And most of the time we do it with just one, okay, to start off. Same principle. Patient is going to lay on top of it. We want to be sure that it's in the middle, right there. And the patient goes and do this, okay? And same. Apply some pressure in here. Specifically for this one, it's never recommended to do it by yourself. It's always recommended to do it with someone because you need help to come out from it. Patient lift their head and then we go, okay? And then lastly, we use one for the lumbar spine. Lumbar spine is this one. We usually start on the bottom. Same principle, you can actually go all the way up along the spine until you can regain the entire lumbar spine curve back. The patient goes and lay on top of this. And say, it's not comfortable, believe me. Patients that had a really straight lower back spine, this one doesn't feel good. This is not a natural movement. For this one, I actually ask patients to bend their knees like this and then lift their hips all the way up. And then I slide this down. Why? If I make them go all the way up, their muscles sometimes tight up and they actually get more pain out of it. Okay, so simple as that. These are blocks. They look really simple, but believe me, they're not. But they do wonderful stuff in your body. If you want to know more about posture, correctional exercises, or other stuff that we do here in the office, just give us a call. Bye.